Hello everybody, my name is Pamela Mariga. I'm the team manager for the Community Learning Disability Service in the north of Worcestershire.
Hi, I'm Michelle Billings. I'm the clinical lead for the Community Learning Disabilities team in the North team for Worcestershire.
We're really excited to be celebrating Learning Disability Nursing 100 years. It's an exciting time and we just wanted to share what we do. Within Worcestershire Health and Care Trust we have different services that meet the needs of people with a learning disability. We have our enhanced care service, and we have a primary care liaison nurse who work with the GPs. We have an epilepsy specialist nurse who works across the county. We have replacement care services, one in the south of the county and one in the north, offering respite services for people with a learning disability. We also have an acute care liaison service, nurses for people with a learning disability, supporting people with a learning disability when they access acute hospitals. And we have our community learning disability service, which is in the north and in the south. Michelle will say a little bit more about that.
Yeah, so our community learning disabilities team is a multidisciplinary team which consists of learning disability nurses, healthcare support workers, psychologists, physiotherapists, speech and language therapists, occupational therapists, behaviour nurses and the admin staff.
Hello, my name's Emma. I'm the area manager for the learning disability team in the south of the county. I've worked for the NHS for 34 years now, 30 of which have been within learning disabilities, which has been an absolute pleasure. And you can imagine I've seen lots of changes in those 30 years, having started my training at an old Victorian institution to now working with people who are living in their own homes and are accessing their local communities, which is a huge step for lots of people. And it's given me lots of pleasure to see the people change and develop and have opportunities that they never had previously. I'm a really proud LD nurse.
Yeah, and we're just really excited to celebrate the 100 years of LD nursing and wanted to share some of our practice that we're currently doing within Worcestershire.
As we've been nurses for some time, we've seen the changes both in the services that are provided and the opportunities for people with learning disability, and we like to feel that we play our part in improving people's lives.
We're really advocating and promoting health promotion for people with learning disabilities, both physical and mental health. And we're doing quite a lot of work with regards to working with other services, mainstream services, to provide advice on reasonable adjustments and breaking down barriers to health services, and working really closely with the GP surgeries to ensure that annual health checks and the health, basically that our guys are getting the service that they deserve within the health service.
The days when people had separate services and weren't able to access mainstream services, we feel we are gone, and that's largely the role that community nurses play, that we look at holistic approaches to people and continue to promote good practice and innovative practice, really.
Yeah, we're very proactive. We go out and do lots of health promotion training with service providers, our service users, carers, other health professionals with regards to people with learning disabilities and their health needs, looking at specific areas also, such as constipation. We work really closely with the People's Parliament and look at specific areas, for instance LEADER, and make sure that we're always improving service for our service users.
By keeping in touch with each other, regular meetings, as Michelle says, we're aware of new practice, new guidelines. That's something that we then need to put into a practical approach, which is something where LD nurses come into their own, really, because we have huge skills of communication, of being able to assess what needs are, to be innovative, and to make sure that everybody with supports needs are promoted.
With regards to other services, we're within the neighbourhood teams, now working with district nurses. We have our acute liaison nurse, our nurse that works within the primary care setting. We have nurses working actually within acute roles within the hospital, within mental health services. So the learning disability nurse is becoming more valued, and we're accessing more services to provide and make sure that our guys are getting a good quality service.
My name is Angie Simmons. I team lead the team.
I'm Stephanie Hopkins. I'm an assistant practitioner within the team.
And I'm Victor Foster, another assistant practitioner.
Also within the team we have another learning disability nurse, Band 6, a support worker and admin support. The team came about from the Transforming Care agenda, and we work quite closely with the commissioners on the TCP. Our main objectives are to prevent hospital admissions and multiple placement breakdowns with people who present with a complexity of needs.
We assess people that have been referred to us. We can implement risk assessments, behavioural plans, deliver staff training.
And for our more complex cases, we offer relapse plans, and we can provide service training for providers.
My name is Ross Golightly, and I work for Worcestershire Health and Care NHS Trust as a learning disability acute health liaison nurse. Essentially, my role is to make sure that people with learning disabilities get the same health care that you or I would, and that their learning disability is not a barrier to them engaging in their treatment. And if it is, my role is to then work with the team members, families, carers, health professionals, doctors, the other members of the MDT to try and break those barriers down or remove them entirely if possible. A big part of my role is training staff. Not a lot of other staff, doctors, nurses, allied health professionals, they don't get a lot of training in learning disability when they're studying, so it's a big part of my role is training and increasing awareness in the vulnerability of that client group. I help different departments within the hospital make the environment more accessible, so different teams might contact me and want some support around how to make their ward area or their clinic more learning disability friendly.
My name's Kirsty Heritage and I'm a healthcare support worker on the Community Learning Disability team. Our role involves supporting GPs with providing the best possible healthcare and support for patients with learning disabilities. We also support service users with completing health action plans, which are offered to every service user, along with offering easy read information for any health issues they may have.
Hi, I'm Matt Armstrong. I'm the occupational therapist from the Learning Disability team. I look at sensory assessments, so sensory processing, and looking at people's behaviour and working with the behavioural team and trying to, if their behaviour impacts on occupational performance, then I try and look at ways to resolve that. We also look at doing environmental assessments, so if someone's relocating to a different property, we look at the environment and if it's going to meet that person's needs. That can involve like providing physical equipment and adaptations. We work closely with the speech and language therapists when they complete eating and drinking assessments and skills assessments. That's another role with OT in our team, so we look at developing someone's skills.
Hello, I'm Amanda Green. I'm a behavioural specialist in the Community Learning Disability team North. And this is my colleague.
Hi, I'm Helen Bitter. I'm a behavioural nurse specialist in the same team as Amanda.
We provide assessments which can include positive behaviour support planning and interventions to help support in managing those behaviours.
We work with other professionals such as speech and language therapy, occupational therapy. Very much our work involves joint working because somebody's behaviour could be due to communication needs, could be due to sensory needs, or their health needs. So we also work with community nurses. And we do this in order to provide holistic care, promote people's health and offer better quality of lives.
My name's Helen. I'm Kat. We're clinical psychologists in the Community Learning Disability team in North Worcestershire. So a little bit about what we do. So we offer psychological assessment, formulation and intervention to people who have a learning disability but who are unable to access mainstream services. That might involve working one-to-one with the person with a learning disability, with their families or carers, perhaps with staff groups, and would include things like working with someone with mental health needs, working with families to help them cope and move forwards, and generally improve their psychological functioning.
Yeah, we also try to support other team members or staff from other services to work with people. So we speak quite a lot with our colleagues from adult mental health services who are working with people who have a learning disability to try and support them in offering those interventions.
Hi, I'm Lynn. I'm a student learning disability nurse from Birmingham City University. I'm currently on placement in Redditch and Bromsgrove Learning Disability team. I've been working with people with learning disabilities, promoting their health and making sure that they get the best out of their lives.
My name's Saffron Davis. I'm a community learning disability nurse in South Worcestershire. I've been in this job for 7 years. I really enjoy it, and I think one main reason why I enjoy it so much is because it's so varied, and also just the uniqueness of everybody that we work with, which I guess is what makes the work varied, because we have to tailor what we do to suit the person that we're working with, and they're all very individual. So that can be really heartwarming and it can be really rewarding.
My name's John Pigman. I'm a community nurse with the South Worcestershire Learning Disabilities team. I've been doing this job for about 8 years, I think now. I have quite a varied caseload, but I tend to lean towards more the kind of people who come from more of a forensic background, as well as having very complex cases on my caseload. I work with social workers and therapists in our joined up team across the whole of the south of Worcestershire.
Hi, I'm Doran. I'm a community learning disability nurse with the South Worcestershire community team. I'm quite new to my role. I graduated this year, so I started with the team in September. The things I love most about my role is how varied it is and how many people I get to meet in my day. And we cover so many aspects of a person's life, and I just feel really privileged to do this job.
My name's Amy Turton and I'm a student learning disability nurse within the team. I started working for Worcestershire Health and Care Trust about 6 years ago as a community healthcare support worker. When I started within the team, I didn't know much about the role of a learning disability nurse, but working in the team hugely inspired me to want to become one myself, and with support from my supervisor and the community learning disability nurses, I have been seconded to complete my nurse training. I am now at the end of my nurse training, and in 5 weeks' time I will have finished and be applying to be a registered learning disability nurse, returning to Worcestershire Health and Care Trust.
I'm Andrea and I'm a community nurse with the South Worcestershire team. I joined the team in October 2018, so I'm relatively new to the post. The role is very different, but very enjoyable. Obviously, I'm now going out into the community, ensuring that the people receive the care that they should be, and it's delivered in the way that makes it acceptable for them, with the reasonable adjustments that people should be making for them.
My name is Lisa. I'm the senior clinician in the South Learning Disability team in Worcestershire. So my role now entails working within an integrated team, supporting the staff and supervising to make sure that people have their health needs met across Worcestershire.